Breg Pinnacle Cervical Collar. There are 3 options available. Pinnacle Cervical Collar 172, Pinnacle Cervical Collar TX 174, Pinnacle Cervical Collar MP 180. Indications for use: post-surgical stabilisation, cervical disc syndrome, cervical stenosis, fracture management, sprains, strains, decompressive procedures, cervicogenic headaches, radiculopathy, trauma, whiplash. Universal sizing. The Pinnacle collar can be adjusted to suit a range of patient anatomy. Liners made from cotton hemp blend. Soft, durable, antimicrobial and sustainable. The anterior panel extends along the mandible. Control rotation and lateral flexion. For continuity of care, an additional set of pads are supplied as standard. How to fit. Remove the collar from the packaging. Detach the hook and loop to separate the anterior and posterior panels. Fold the back edges of the anterior and posterior panels to improve overall fit. Ensure the chin support piece is at its lowest position. The grey material should almost be touching the white. Your patient's head should be held in line with your trust or hospital's lifting and handling protocol. Compress the bed and slide the posterior panel under the patient's neck. Ensure the hook and loop is centred between the bottom of the ear and the trapezius. Slide hands over the pad to ensure it is flat. To ensure the panel is central, lift the 2 straps, ensuring they are of equal length. Offer up the anterior panel, ensuring the dial is in line with the sternal notch. Fasten the straps. Adjust the dial until the padding touches the skin and the patient's neck is in a neutral position. Lift and tuck the collar underneath the patient's ear and retighten. Repeat on the other side. Lifting the collar relieves pressure on the clavicle. Finally, flex the tabs to contour for comfort. When fitting the MP 180, the final step is to release the closure on the posterior panel. Allow the pivoting occipital support plates to find their natural place and fasten. How to replace the pads. Take the posterior panel and detach the back pad. Fold the replacement pad to align centrally and attach to the hook dots. Take the anterior panel and detach the chin and chest pads. Fold the replacement pads to align centrally and attach both pads to the hook dots. The pad should sit above the plastic panel. Care and cleaning. Hand wash pads in cold water with a mild detergent. Rinse and air dry. Caution: for single patient use only. Warnings. Carefully read fitting instructions and warnings prior to use. To ensure proper performance of the product, follow all instructions.